Dr. Vuong, we did talk about dentures and stuff like that. There's currently a whole bunch of news out there that the denture cream, the Fixodent, the stuff which glues your denture to the palate, which is needed if dentures become loose, apparently has too much zinc in it, or it may not have too much zinc in it, but the constant use of it, people seem to be getting zinc poisoning. And really what that meant is, apparently, it's not proven as such, but there are lots of rumor out there, and lots of news. The zinc goes into the gums, and we know that the gums are the whole mouth is the gateway to the blood vessels, and they get numb feeling, tingling feeling. They get, literally people become nerve damaged, mentally and physically. Some cases quite severe, not 100% proven, but every prosecutor is working on it. Fixodent is one of the big companies, and of course they are changing their thing. But it looks to me to have this glue in it. Glue is glue. I mean, glue couldn't possibly be healthy, in my humble opinion. Never mind that it must be uncomfortable. So wouldn't an implant-supported denture be the real thing to do there? Because then the denture will always fit. Would an implant-supported denture solve that problem, regardless of whether the zinc poisoning comes from the glue or not? But just to make sure to avoid it, never have it, and on top of it, have a much better denture to eat, bite, and taste food.
Definitely. I definitely recommend all my patients, even all the denture patients, to come in at least once a year to have their denture evaluated and adjusted to make them fit better. A lot of dentures don't need glue to fit well, especially the upper denture. I would say 95% of all upper dentures don't require adhesive to fit really well. The bottom denture, I would say that's where a lot of more people need to use the adhesives. And one of the best ways to solve that problem is getting dental implants.
Because the denture, most people, think, from what I hear, they come in with the denture and say, my denture stops fitting. They think that the denture became bad, when it really is that their bone is shrinking. That the denture stays the same. It's their bones are shrinking, because when there is teeth missing in the bones are shrinking, and it's unavoidable. It will keep going all the time till they die. Am I right there?
That's right. When we're a dentulous, there's no forces that are really being applied to our bone structure here. And so we're constantly getting shrinkage of the bone, and even the gums, and everything is shrinking constantly. And so through the years, of course, the denture doesn't fit quite as well. And that's why we need to come in at least once a year to have some adjustments, evaluation and adjustment.
And that can all be avoided by putting implant dentures in it, by putting a couple, 2, 3, whatever it takes, implants on the denture, snap them on, and that problem is solved forever. Yes or no?
It definitely helps with the situation, and it's solved. I wouldn't say forever, but for a long time. It definitely gives us much better biting forces, and the shrinkage of our jaws still continues, but it doesn't quite affect the fit like dentures without the implants.
Got it. So the chances of needing a glue ever is literally nil.
Oh, it's pretty much nil. I've never seen anybody with implant-supported dentures needing glue.
Got it. And you said the bite. So with an implant-supported denture, can you chew on a prime rib or on an apple? Because with a normal denture, I don't think you can do that.
With a normal denture, definitely not. You simply don't have that kind of bite force with a normal denture. It just slides around too much, slips, and just rubs the gums and causes pain and discomfort. With the implant-supported denture, because the implants lock the denture in place, you could literally bite into an apple or tear into some steak rather comfortably.
Wonderful. Well, because even if for some reason the denture wouldn't come off necessarily with normal, relatively careful eating. Who wants to eat careful anyway? I mean, that's the last thing you want to do. You want to dig in, But just the feeling that it could come off probably puts a tremendous amount diminishes the self-confidence in people by kind of, well, I better be careful. I'm amongst people here, and I don't want this thing to fall out. And yet when you have dentures, it doesn't happen. I mean, when you have implant-supported dentures, it just won't happen. And also there's the matter of tasting the food better when you have the implant-supported denture. Explain that to us. You explained that to me in a different video rather good. Explain that to me again.
Well, when you have the implant-supported dentures, we can make a denture that's much smaller, that doesn't cover the palate, and which exposes the taste buds. So you're going to have all your natural taste buds, which allows you to actually taste the food a lot better. With a traditional denture, the entire palate, including part of the soft palate, is covered by the acrylic denture, which blocks out all the tastes that we normally have.
Got it. Okay. Well, all right. Well, back to the cream, the denture cream problem, the zinc poisoning, so to say, where people get numb fingers and other muscle weakness and all that. If a person experiences that, I guess he should go and try to do a nerve test anyway, regardless whether he wears dentures or not. If a person gets weakness and numbness in the muscles, in the extremities or anywhere else, he should do a nerve test, because nerves, if it gets caught fast like everything else almost, can be repaired. If not, they're over the hill. But let's assume a person has had some dentures lately and some denture cream, used it often, not so often, it doesn't matter, because different people respond different to different things. Would you suggest that he goes and looks up a doctor and gets some evaluation to see whether his nerves are fine, and then get it maybe fixed by getting an implant-supported denture and never has to wear it again?
Definitely. I think there's two different issues there. If they have some nerve issues, number one, you should definitely get evaluated either by a dentist if it's in the mouth, or by a physician if it's elsewhere. But implant-supported dentures are the way to go. Whether you have a nerve problem or not, implant-supported dentures are going to be more comfortable, allow you to taste more foods, allow you to eat more foods more comfortably and naturally, and you're going to enjoy them a lot more.
And isn't life all about being enjoying, right? Thank you very much for your candidness. Bye.
Thank you.